How to complete the integumentary assessment. As we look at the integumentary assessment, of course, when we enter the room, we need to knock and introduce ourselves and explain what we're getting ready to do. To focus on the integument, we're looking at the skin. So make sure that we're always including the locations and sizes of different areas. So we look at the color. Again, look at the mucous membranes and or the nail beds. Determine what color you might be seeing. Is it pink? Is it erythemetic? In other words, is it red? Is it cyanotic? Do we see paleness or pallor? Do we see that jaundice, that ashen color or mottling? Is it in just one particular area? Is it located everywhere? If it's everywhere, we can say generalized. We're looking at varying pigmentation. So are there areas of the skin where we have different colorations of the skin, such as freckles or those red spots called angiomas? Do we see moles? Do we see bruises? Again, where are they located? And what size are they? If there are multiple, for example, freckles, then we would say there are multiple freckles scattered over the client's face, or over the shoulders or the upper chest, etc. So describe what you are seeing. Are there any lesions? And a lesion can be it's basically something abnormal. So is it a wound of some kind? If it is a wound, then we need to not only assess the wound, but we need to assess the peri-wound, the exudate or the drainage. We need to obtain those measurements, and you will find how to assess the wound in your integumentary presentation. Is there any odor to the wound? And what type of tissue are you seeing in the wound bed? Those are all really important whenever you see a wound, unless, for example, it's a laceration. Um, we may not necessarily be documenting the wound bed type, but if it's a pressure injury or it's an abrasion, etc., definitely get the wound bed type. Describe where it is, describe its the area around it, which is the peri-wound, etc. Does the client have any tattoos or piercings? Again, if they do, where are they? And if it is a tattoo, then you may want to document the size. So you may say tattoo to left upper arm. Well, unless I document the size, I could interpret that as being a tattoo that covers the entire left upper arm from the shoulder to the elbow, or I could mean that maybe there is a 3 centimeter by 3 centimeter tattoo. So get a little bit of description there so the next person knows if this is something that is new or if it's something that has been there. Um, maybe it's been a couple of years since they've been in the facility. You know, we need to know what is different. We need to assess the skin turgor. Again, understand that you should not be assessing skin turgor on the back of the hand. As we age, we tend to lose the elasticity in our skin, so we may have some tinting to the back of the hand that is perfectly normal and does not indicate that there is dehydration or some issue going on. So Always, always, always obtain the skin turgor either on the forehead, the clavicle, or the sternum. We need to assess the temperature, and when we're assessing the temperature of the skin, we should be using the back of the hand. It's more sensitive to those temperature changes than our palm is. So assess the temperature of the skin, and as you're doing that, what is the texture? Is it smooth? Is it rough? Is it scaly? Is it cracked? Etc. What is the moisture of the skin? Is it moist to touch? Is it dry to touch? And we're also looking at hair distribution. This can be an indicator of circulatory issues or some types of skin conditions. So, do we have adequate hair growth, or is it really thin? Is it extra hairy? And then, of course, always complete your closure. Does the client have any questions? Is there anything you can do for them? Making sure that the bed is in the low position, that the upper rails are up if necessary, call lights within reach, bedside table is where they can get to it.